I like working at Phelps Hospital Northwell Health because I really share their values. I share their mission. The mission is to improve the health of the community in a compassionate way. When you walk through the doors and you carry a diagnosis of a cancer, it's very stressful. There is a saying that, a cheerful medical team is half the cure. So when you enter the room and someone is greeting you with compassion, they are smiling at you, it's really helpful. Hereber actually saw me in 2018. He had metastatic prostate cancer. And over the years, he failed one treatment, so we switched him to second treatment. Subsequently, he ran out of all his treatment options. As oncologists, we sometimes break some of the worst news for the patients. And, we've seen people sometimes, crying in our offices. Sometimes they are rejoicing when we say they are cured. So we see extremes of emotions. And I was worried how he's going to take it. And when I entered the room, he was smiling. And when I broke the news that his cancer is progressing, he was still smiling.
Herbert tried every single line of chemo treatment. And as he was seeing us every week, we were saying that this last line of treatment is not working, so he should try to go home and be comfortable with his family. And he kept on saying, I will, I will, I will. But weeks after weeks after weeks, he was still coming back. He finally admitted that he doesn't have any money to buy his plane ticket to go home. So that's when I came to Dr. Thacker and I said we should try to do some kind of fundraising, so then that way he can afford to buy a ticket to go home and also go back with some kind of fund so his family could also need that fund to help him out at the ends of his care.
A lovely man, always positive, very optimistic. Even though things were not always looking so good for him, he was a really wonderful guy.
Austin man is to return to his home country and be with his children who he hasn't seen in 3 decades. News 12's Nadia Galindo shows us the incredible effort being made to make that dying wish possible.
Hugs, kisses, goodbyes, all made possible by a medical team that went beyond the job to deliver a final dying wish.
All I thought was we were probably going to sponsor him a trip to his country and then they'll have the onus of taking care of him. But I did know that it was going to be challenging because he needed to take care of the fluid in his belly. He needed some medical supplies in the form of tubings, nursing support. But I still felt it was important for him to be with his family. But with the support of our outpatient cancer center, our infusion center, our hospital administration, we made sure that he has enough supplies to keep draining his fluid and changing the bags. We even send him with enough financial support so that he can have a private nurse to take care of him when he goes to his country. When everyone got together, it just took everything to a next level.
I came to know Herbert through the oncology team, through Vaughn and Dr. Takar. If he's facing a limited life expectancy, how can we know who he is and know what's important to him? What was really most important to him was his relationship with God. He was such a spiritual person. He had this amazing faith. He had this amazing belief and hope in Christ that just kind of lit up a room. When you talk about joy, when you talk about hope, he really lived it. When he came in, he was asking more about us, not more about what was happening with him. And especially as we came closer to near the end of his life.
What really brought us together was Hereber. He was such a kind and caring person that we knew we needed to work together to get him home to his family in Guatemala. I still think about what Hereber said to us before he left. He gave us all a big blessing, and he said to me, "Never stop doing what you're doing. You were made to do good." And I'm really grateful that I met him.
The team worked together to fulfill Herbert's dying wish to go home to Guatemala. He was able to do this and to spend 2 months reunited with his family at home.
Thank you, Herbert, for fortifying my faith, for knowing that love is real, and that despite life circumstances, there is hope.
We are always trying to make changes in the life of our patients. We are always trying to make their lives better. But sometimes you need to go beyond what is normal, and that comes with the Phelps DNA. The culture here the humility, the patient-centeredness, the compassion. It just reflects every corner of the hospital. And I'm really happy for him. And I think this is a story where, this also says that America is a great nation. There is a saying that helping one person may not change the world, but when you help that one person, it changes the world for them. So I think this was the key aspect of what we did for Hereber.